means what it means, against gravity. Gravity eliminated or gravity reduced means your client is not able to move in a normal plane of motion, so you have to put them where gravity is reduced or eliminated and move it that way. So typically, everyone that walks into your clinic is probably at least a grade 3. Grade 3 is going to be your baseline, okay? So if I ask Dr. Rubio, can you bring your leg to the ceiling? Relax. I at least know she's a 3. That's always where you're going to start, and that's what's called a screen, okay? So, don't move your leg. Okay. Can you move your leg to the ceiling? You see your clients really trying. Obviously, they're having a hard time moving against gravity. That's going to cue you to put them in a gravity-reduced plane. But she was able to move against gravity, so we at least know she's a 3. For hip flexion, this is the position. You want them to be holding onto the edge of the table. Your hands always need to be on your client, okay? If you're measuring manual muscle testing or even goniometry, both your hands should be doing something, okay? So you shouldn't be like, okay, can you bring your leg to the ceiling? And you have like one hand over here. I want you to stabilize the trunk, okay, or the hip. So here's my stabilization arm. Can you bring your leg up? Okay. So when you're providing resistance, you want them to be halfway in the range of motion, not all the way up, just about halfway, okay? So what I'm going to do is, I'm going to provide resistance. I'm sorry, you're tired. Like that. So what I'm going to do is, 1, 2, 3, relax. Okay, so she was able to hold against maximum resistance, which is about 3 seconds. That means she would get a grade 5, okay? 3, able to move against the range of motion, against gravity, no problem. 4, so this would be a 4. Bring your leg up. 1, 2. Okay, so she kind of gave after about 2 seconds. And then a 3 automatically. If you know that you screen them and then you try to provide resistance, or bring your leg up, and automatically goes down. You need to provide the same amount of resistance to the same clients across the board. And I mean really providing resistance. And I will come around and show you what I mean about that. Obviously, you're going to be taking care of your frail elderly patients, but to actually be a 5, you're providing maximum resistance, okay? So you really need to get in there and make sure you're really providing that good resistance, okay? Bring your leg up. 1, 2, good. All right, so that was hip flexion, okay? So now we're going to do knee flexion and extension. All right, so for knee extension, can you bring your leg up? No. Yep, good. So resistance is always applied opposite to the movement. So if you're trying to test for knee extension, you're pushing into flexion. If you're trying to test for knee flexion, you're pushing into extension, okay? Resistance location is the opposite of the movement. Dr. Rubio, can you bring your leg up? Wait, I'm sorry. So we screened. We already know that she's at least a 3, correct? Bring your leg back down. Okay, I'm going to stabilize again. Bring your leg up. Hold against my arm. 1, 2, 3. Relax. Okay, so she was able to hold against maximum resistance. She's a 5, right? If she broke after a couple seconds, it'd be a 4. If she could not hold against any resistance, she's a 3, okay? So for flexion, resistance would be opposite. So this is for extension, this is for flexion, okay? I'm stabilizing. All right, can you bring your leg down? 1, 2, 3, okay. Dorsiflexion, plantar flexion. You can still stabilize on the table, that's fine. So for dorsiflexion, and plantar flexion, you're gonna stabilize right here. Resistance for dorsiflexion is the location of plantar flexion, right? So she's going to bring her toes to her nose. We know that she can go against full range of motions, or she's against gravity, so she's at least a 3. Now I'm going to provide resistance. I'm going to go at the top of the foot, okay? Now I'm going to push down. 1, 2, 3. Excellent. Plantar flexion. Bring your toes to the floor. I'm going to push in the opposite direction. 1, 2, 3. Good. I know that's a lot. So let's recap. 0 to 5 muscle grades. You always screen, no matter what it is. You want to screen for the motion. If you see that they can go against gravity, then you provide resistance. You try to provide resistance for 3 seconds as your reference point. That would be your grade 5. We should all pretty much be at least a 4 or a 5, okay? Barring any kind of issue going on. If you have an issue, just let us know, okay? And then, so say Dr. Rubio could not move against gravity, and she needs to go in a gravity-reduced plane. On your side. So for hip flexion, you're going to be supporting the weight of the limb. That's the gravity-reduced plane. We're in a sideline position because against gravity would be sitting. This is gravity-reduced. I'm supporting her leg, but I'm not going to be doing the movement, okay? I'm going to have her do the movement. Can you bring your leg up? Okay. Can you bring it up? I'm not moving her. I'm supporting her. Because a lot of the times, hip flexion is a very big movement, and some of your clients are not going to be able to move against gravity. So this is a good way to see, do they at least have full range of motion in a gravity-reduced plane, which would be a grade 2. Okay? So 3 is against gravity, full range of motion, not able to move at all, then you go to the gravity-eliminated position, which is sideline. Support the weight of the limb. They move through full range of motion, you know that they're a grade of a 2. So say they can't, okay? What are the muscles for hip flexion? Right. So good. So say your client could not move against in a gravity-reduced plane, then you're looking at least for a muscle contraction, which would be a grade of a 1. And you're looking in the location of the hip flexors, right? Okay. If you felt a twitch, it'd be a 1. If you feel nothing, it's a 0. Those are those muscle grades. For the sake of the practical, for the lower extremity, we're going to be asking you to do this gross assessment, and then we're going to pick one gravity-reduced plane that you need to put them in. So say I have need for the practical, and I say, what position would your client go in for hip flexion gravity eliminated? You would say they would go in sideline. This is what I would do, okay? Does that make sense? All right, so for knee, same thing. Supporting the weight of the limb down here. Can you bring your leg out? Can you bring your leg back? That's knee. Knee flexion and extension, gravity-reduced plane. And then plantar flexion and dorsiflexion, side lying as well. Can you bring your toes to the ceiling? Can you bring your toes to the floor? Okay? Relax.
Quick question. Did you say gravity eliminated?
Same thing as gravity reduced. Some people say it differently. So what I mean by gravity eliminated is, think of where the muscle is pointing. So for hip flexion, I'm pointing towards the ceiling, okay? If I'm trying to get out of that gravity, against gravity.
What?
Oh, I thought you were trying to.
No, I'm just listening.
I thought you were trying to. Then you're trying to remove gravity. By doing that, you're not facing the ceiling anymore. The muscle is not pointed up. You're supporting the weight of the limb. They're able to move that against in a gravity-reduced plane. Does that make sense?
So think of it, if you're vertical, your gravity is pulling down. So you want it to be horizontal. We are going to ask, just like Dr. Rubio said, when you're trying to find your trace or your 1, we're going to ask where you're going to palpate to feel for that muscle contraction. So make sure that you know what muscle you're going to palpate for a muscle contraction. And we're going to ask you to tell us all the grades. This is a 5, this is a 4. So my client's displaying a 5 out of 5 muscle strength or 5 muscle strength. For hip flexion, if it was a 4, they would break at 2 seconds. Or if it's a 3, they would go through full range of motion. If it's a 2, would be in a gravity eliminated plane. This is where I would feel they could move it. If it's a 1, this is where I would feel for a contraction. If I feel nothing, it's a 0. So you're going to have to explain that to us for your movement, okay? We want to know all the grades. So, is that how we're going to do it? Like, then, okay, and then put them in the gravity eliminated
Just
plane?
for 1.
Just for 1, okay.
It could be hip, it could be knee, it could be ankle.
Yep.
So we're demonstrating one, but explaining all of them?
Yes, we
Okay.
want to know that you know what all the muscle grades are and how you would find them.
Okay, so we're not demonstrating all 5, we're just saying them out loud.
So you're like, why don't you show them exactly what they would do for hip flexion with Dr. Rubio?
Table again. Okay. Hip flexion. Bring your leg to the ceiling. Good. That's my screen. All right. I'm gonna provide some resistance. Bring your leg up again. 1, 2, 3. Good. Can you kick your leg out? Good. That's great. I know she's at least a 3 for knee flexion or knee extension. Bring your leg up again. 1, 2, 3. All right. I'm gonna do the same thing for flexion. Bring your leg down. 1, 2, 3. Good. Can you point your toes up? Good. Can you point your toes down? I know she's at least a 3. I'm going to provide some resistance now. Can you point your toes up? 1, 2, 3. Point your toes down. Provide resistance. 1, 2, 3. Relax. That's what you're going to do across the board. And then I'm going to say to you, can you tell me what the muscle grades would look like for hip flexion?
So let's say Dr. Sarah is your instructor,
Correct.
and Dr. Sarah tells you as a
Yes.
student.
Correct.
Explain to me what your muscle grades would be for a 5 through 2.
Okay, so a 5 is, I'm sorry, a 3, the client was able to move through full range of motion, so I applied some resistance, so they were able to hold against max resistance for 3 seconds, that would be a 5. If they broke after a couple seconds, it would be 4. If they could hold no resistance, it would be a 3. If they were not able to move against any kind of range of motion against gravity, then I would put them in a gravity reduced plane.
Can you show me that position?
Sure. So for hip flexion, it would be sideline. Actually, for all of them, it's going to be sideline. So it would be sideline for hip flexion. I'm going to support your leg. Can you bring your leg up for me? Good. That would be a 2. They move through full range of motion. If they were not able to move through full range of motion, I would be palpating for the hip flexors, which are here. If I felt a muscle contraction, that would be a 1. If I felt nothing, that would be 0. If you were asked about knee, same thing. But you'd be down here talking through the same thing. Does that make sense? That's what you're going to be asked to do. Okay? So you're going to do the full assessment, hip, knee, ankle, for against gravity, and then we're going to ask you to explain the muscle grades for one movement, 0 through 5. Okay? And please don't be dainty. We're not dainty in here. Okay? We're really providing resistance. We're really getting after it. Yes, ma'am.
For muscle grade 1, what will we have to know, like a list of specific muscles
Uh-huh.
for each type of,
And on your PowerPoint, if you look at the template, it shows you like we want the muscles listed with the innervations. So when you're studying, you literally just go through and your hip flexors are these, innervated by this.
okay, and then a contraction just feels like them
You-
trying to do it.
Exactly, you'll feel it. It's like they're trying, you'll feel it. It's a trace movement, is what it's called. And it's hard here because we're pretending, right? In
Right.
real practice, you'll be able to feel somebody that really can't move against gravity. You know what I mean? Like it'll be very obvious. Just here, we're pretending, so it's harder. Yes.
In our practical, we automatically screen for 3. Like, can we
Yes,
say that?
that's where you want to start. You'll screen all of your movements, actually. Even goniometry, you're going to screen. Goniometry and manual muscle testing, you always do a screen. Why would we screen? Anybody know?
This way.
Right, and then just see, you know, if there's an obvious deficit going on, you know. Okay? I don't know, I can't hear anything. Okay. So let's break off and let's practice that. Let's practice all of the motions that Dr. Pignon already showed us. We did hip flexion, correct? So this is hip flexion. See where I'm holding? I'm sorry, my hands are so cold. I'm already supporting her leg. In Clarkson, it says your iliopsoas cannot be palpated. But honestly, you can palpate part of it here by the ASIS. So for grade 2, I will support the weight of her leg. Then I'll ask her to move her leg. Okay, so can you bring your leg towards her chest? So I'm doing this. So that's it too, because she can do it. If I'm palpating, I'll put my hand here. I'm using my trunk to keep her from turning or from falling back towards me. So I will guide her leg
into hip flexion, and my hand is palpating. All right, so this is how I'm supporting her leg. Now, if I'm doing the knee, I can switch my hand over. All right, so your knee extensors will be your quads. You can palpate for the vastus medialis here, lateralis is over here, and your rectus femoris is right there. So you can put your hand here and start palpating as you guide the knee into extension. You can also palpate that as one tendon here in your what is this? The
Patellar ligament.
Oh yeah, so you can palpate it right here as she's extending. Okay. Now for knee flexion, I'm gonna have you face the other way so Anna can see it. Okay. Turn that way. Just so this is just for the camera. Okay. I can support her leg right here. Then I will have my hand here in the popliteal area, so I can palpate for your biceps femoris here, and your semimem and your semitend as aggregate muscle. Then I'll guide her leg back towards knee flexion. You guys see where my hands are. So I'm using my entire arm to support her leg. This is knee flexion, and this is knee extension. Okay, so the optimum position for me, at least, is she's facing away from me. I just asked her to face me so that Hannah can see me. All right, so now for your ankle, this is dorsiflexion, this is plantar flexion. What's your dorsiflexor? Tibialis anterior, which runs from lateral to medial. So you can palpate it here as the muscle belly or here in front of the ankle. Okay, so I can support, okay, and then I can guide her ankle towards dorsiflexion as I'm palpating here. What's my plantar flexor? Gastroc. So as she plantar flexes, I can palpate for the two heads of your gastrocs here in the posterior area. Clear? Questions?
That's when, if you're asked to explain all the muscle grades, especially for a grade of 1, you need to show us where you're palpating for, okay? Make sense?
So if it's 1, I'm guiding her leg and palpating at the same time. Then I'm saying, if I can feel any contraction, it's a 1. So right now, as I'm guiding her leg into flexion, into knee flexion, I can actually feel those tendons popping out. So you're probably a 5, but I would say she's a 1. If there's nothing there, it's just empty, that's a 0.
Yeah, so if you're asking us to like palpate and like tell you what muscle we're palpating for, do you want us to tell you like all the muscles that do the action, or do you just want to know what muscle we're palpating?
Exactly what she said, there's not very many. So for hip flexion, she said 2, right?
Okay.
Iliacus, iliac, or the psoas. And then for knee flexion and extension, she just went over all of them. And then for plantar and dorsal, just that.
Just what she said.
You can just
Okay.
quads.
Yeah, you could say quads or hamstrings. If
Okay.
Dr. Sarah is okay with that.
That's right.
And then
Just make sure you say the right ones.
Okay.
And don't just say quads and hamstrings. Say the right ones.
Make sure that you show us where your hand is placed, not just in general. I'd be palpating here.
Okay. And I think that's why Dr. Rubio is trying to tell you, like, she's guiding the movement because she can actually feel the muscles twitching and moving. Does that make sense? Whereas a 2, you're not doing the movement, but as she's guiding the movement, that is cueing her, okay, this is where I would be palpating. So you guys can totally do that too, okay?
Yeah.
If you're like stuck and you're like, okay, I'm trying to figure out what knee flexion and extension is, just do the movement. It's okay to do that, especially if you have plenty of time left in your practical. Go slow, think about what you're doing, and guide the movement if that helps where you're palpating.
And
Okay?
if you guys can see, I'm using my right hand as a support, but also a palpating hand. Right? So I'm using this to support the weight of her thigh, but at the same time I have it over the muscle belly so I can feel any contraction. And I've got small hands. Not a problem.
Can you show us in this position the hamstring one?
So put hamstring is gonna be right here. Yeah, okay.
Our hamstrings do what?
Knee flexion.
So you won't be able to see because I have my hand here, but my fingers will be at the back of her knee. I'm doing that. So can you turn towards me again? Yeah. So what I did was I had it right here. Does it feel right? Yeah. So it's like this.
But you do it with her facing this way.
No, she's just showing Hannah.
I'm showing you where my hand was.
Right,
But
okay.
if I were, but the way I'm gonna do it is, again, like this.
Right, okay.
It's whatever you feel comfortable with, as long as you're not up here for the hamstring.
And when you're doing the practical, we can walk around you anyway. We'll be looking over your shoulder and see if you're reading your going right. So, what you want to do is position yourself correctly, so you're watching proper biomechanics, and then you're supporting your person's limb appropriately.
Is the level one with muscle twitching thing, is that involuntary or is that like would someone naturally do it?
That should be voluntary contraction because they're trying to assist you. So with you guiding the movement, you're facilitating muscle contraction as you support and guide the person's body towards it. They're actively trying to move that joint. Okay. Question.
Well, so you'll ask them, like, say you're at like a 1 and you know they can't move on their own. Will you still ask them to actively try? So you, okay.
Yeah, it's like, okay, go ahead, try to straighten your leg. You're telling them to move with you.
Okay.
So you're not only assessing muscle strength, but in a way you're already telling your person try to move the leg. You're giving them a cue to start using their muscle, which is important if you have a neuro patient, for example. That's, I don't want to confuse you anymore, but yeah,
okay.
you're already facilitating muscle contraction while you're also assessing how
Okay.
much muscle strength they have. Okay.
Can you show zero?
Zero would
Zero.
be, zero is the same thing, only I have the correct hand placement, I still have the same hand placement, but I would say if I don't feel any contraction or I don't see any muscle twitch, it's going to be a 0. If you can't see or feel anything, it's a 0, but my hand placement is still the same for a 1. Okay? Okay? All right? Any other questions?